Good evening, everyone. My name is Susan Reyna, and I'm here today with Melanie Glubisz. And for the next 30 minutes, we'll be talking about Beacon and our fax services. This is a live call-in show, so please feel free to call. The number is listed on the bottom of your screen. It's 312-738-1060. Before we start talking to Melanie, I'd like to talk a little bit about Beacon. Beacon is a non-for-profit social service organization that was started in 1968 by parents who were looking to find an alternate special education program for their children. Today, 40-some years later, we have different locations. I'm going to put those locations on the screen. We have our administrative office on 1912 West 103rd. We have our homeless services outreach location, which is located 117th and Western. We have our Calumet Park campus and our Longwood campus. We do offer a myriad of services, and they, of course, are day schools, our shelter outreach services that provides mobile mental health services to homeless women and children. We have a CHIPRA program that enrolls children into Illinois' All Kids Insurance Program, and we specifically target homeless youth. We have an early Head Start program that predominantly works with homeless families. We have our FACT program that we will be talking a little bit more about today. Our Family Homes initiative that works with highly vulnerable families. We have a PATH program that works with the seriously mentally ill homeless adults. And we have a little intensive outpatient program. Essentially, it's day treatment programs for children ages 3 through 12. And then we also offer a traditional outpatient mental health clinic. And what we like to see ourselves doing over the years is really working with families that are challenged, individuals that have had seriously disadvantaged beginnings, and providing new engines for them. And that's what we try to do every day, and most specifically, that's what we're doing in FACT. And so, Melanie, thank you for joining me today.
Thanks for having me.
So tell me a little bit about your background. I know you work in the FACT project, and we can talk about that, but tell me a little bit about your background.
Well, I graduated from the Chicago School of Professional Psychology in 2011, and
God, that was recent. Okay.
Yeah, very recent. So, FACT was what I found right out of graduate school. What really enticed me was the population that you service, and the fact that I would have the opportunity to work with mothers and their children of the homeless population. I was really drawn to that and really wanted to help them. And work with them in that sense.
Well, and I know you have some unique certifications that I think really it's a great find for us to have you have joined us because you have some unique skill sets that really are geared towards working with mothers and children. So can you tell me a little bit about that?
Sure. I'm a licensed professional counselor on my way for LCPC, and
Yay.
I also have a certification in trauma informed CBT. And so
what does CBT stand for?
CBT is chronic behavioral behavior therapy. So it's a type of therapy that specifically works on cognitions and behaviors. And with that certification, you work with the trauma and the changing the way you think around the trauma. And I'm currently, thank you to Beacon, working on CPP certification, which is child parent psychotherapy, which works on or looks at relationship building with the family, and it specifically looks at the trauma that the family has experienced, and it really looks at the trauma, and you talk about the trauma rather than avoiding it. It's bringing it home and discussing it openly as a family to work on that relationship together and build a stronger attachment to one another.
I think, there's this heavy emphasis on trauma. Mm-hmm. And, we know Beacon has a very strong philosophy of care. And so we look at the philosophy of care really guiding all the work that we do. Mm-hmm. And it being trauma-informed is one of the basic tenets of what we try to do in all the work. So clearly the work that you were specially trained really fits very nicely into what we do. And I think particularly the CPP work really, as I understand it, really gears towards strengthening the parent-child attachment and fortifying that. And we know that a very solid parent-child attachment can really lead to healthy functioning, resiliency, all those protective factors that we know leads to healthy adults and healthy living.
Right.
So you had all this special training, which is fabulous. So you bring that to the FACT project. So tell me a little bit about the FACT project.
So the FACT project FACT stands for Family Assertive Community Treatment, and it's a very comprehensive model where we have a housing specialist, we have an employment specialist, parent-child specialist, a CADC, which is somebody who works on substance use and abuse. And then we have 2 supervisors, one of which is more child-based supervision. The other one is our general supervisor. And although we hold our own caseload of 10 to 12 participants, we each service every participant that is part of the program. So it's a very cool model where we get to, I pretty much have 36 clients, as does our housing specialist, as does everybody else on the team, and we really get to work closely with everybody that's part of our program. So there's not one participant that we don't know well.
What do you think are some of the strengths in that, in terms of everybody sharing a caseload like that?
Well, there's several strengths. Clinically, it helps us feel less of the stress and burden that might come with each case. So some weeks it might be a heavier week depending on what's going on with that family. So that helps in that sense. But then when we come back to the table to discuss the cases and what's going on, it helps us really get a better picture of what's going on in the family and better understand and how to service them. I might get one piece of information from that participant one week while somebody else might get another piece. So it's putting the puzzle pieces together and forming the final puzzle. And
and I think it's a multidisciplinary team, as you described. So they're all masters trained. So psychology, social work, and then there's different specialties, obviously, you're describing.
Right.
And I think the other piece that makes the initiative, it is very cool and it's very innovative, is that there's a fidelity scale to it, which means that it's based off of the assertive community treatment model, which is an evidence-based approach of working with the chronically mentally ill, and it's been tweaked to really respond to the needs of homeless families. So we have some great outcomes. And what are some of the goals of the project, of the initiative?
The main goal that we have for each participant is for them to become self-sufficient. So each participant has their own set of goals, individual goals that they want to meet, which we work closely with them and helping them and guiding them and supporting them in any way that we can. But the main point is for us to be there to support them along the way, and then with the ultimate goal being self-sufficiency.
I'm actually going to put a listing of the services, and maybe if you can describe them a little bit.
Sure.
So this is an array of services. Can you describe some of them?
Sure. So mental health treatment, all of our participants are able to get therapy services with our team. Some it's designated therapy where we meet with them weekly. Otherwise, maybe we'll show up one week and they say, I really need a therapy session. Let's talk, and that's how we approach that. Along with that, too, they have the ability to see our psychiatrist or our psychologist for screenings. So that allows them to work on those skills as well, on those issues as well. Crisis intervention, so that might be whether their landlord is threatening to evict them, we might have to work at that with them, or it might be something more serious such as domestic violence or suicide threat, unfortunately, but we are there to support and guide them through that. Housing location, we work with them to find housing for them. So the way that they come into our program is you have to be homeless or at risk of homelessness, and you have to be a woman between the age of 18 to 25.
Yeah, and I'll put this on there as well when you're talking about some of the services. And I know one of the things that there's a heavy emphasis on community support systems.
Yes.
And it being trauma-informed, which we talked about. And, harm reduction. What is harm reduction?
Harm reduction is the model that we try to follow very, very closely in our work. So harm reduction is meeting the participant where they're at. So what that could mean is I might come to one of our participants' home tomorrow and plan to do a children's screening. But when I show up, their need at that time may be that I really, really need a ride to get to my job interview. I have no way of getting there. Can you please help me? So we'll try and either help them come up with ways of getting the transportation on their own, or we help them provide it, and then after that we work with them on ways that they can get it on their own in the future. So at meeting them where they're at is exactly what it is. It's just seeing where they're at that day and helping them where they're at in that moment.
And I think the other unique caveat to harm reduction is really recognizing the array of risky behaviors that we all engage in at different points, but clearly our families may be engaging in. And rather than, immediately rushing to cast blame or to say no, which many times by adopting that approach, all you succeed in is losing the participant. Is, essentially, again, going back to meeting them where they are and talking to them how they can reduce the impact of those risky behaviors and those dangerous behaviors. And I know we put the criteria on for the population, so it's young moms ages 18 to 25 who have one child under the age of 5, and also that there's some other complicating mental illness or mental health issues. And I know a lot of the moms come from DCFS backgrounds.
They do. I'd say majority of them do, yeah.
And then so what kind of, that brings me to talk about collaborations and partnerships. Who else, and actually we should have probably said at the outset, this is, Beacon is the lead on this initiative, and the staff that you described, some of them are Heartland Alliance staff. So it's a team approach. So we partner with Heartland quite a bit, but who are some of the other folks that we work with, or what are some of the things outside of the actual project that we're doing that also impact the work that's being done?
Sure. So we have a planning coalition which works closely on collaborating with different agencies throughout the Chicagoland area, some of which, and part of that planning coalition are separate work groups. So we work closely with early intervention, early Head Start. I know Department of Human Services has sat on that coalition as well. So we work closely with each agency to start making links so that we can advocate for the population and for our participants so that we can service them better, and as well as the population itself.
I know some of the key things that I know that is part of the planning coalition, some of the successes for the systems integration work essentially has been really informing these other policy-making entities on the unique needs of homeless families. And we know for a lot of systems like Early Head Start you described, they're supposed to be targeting the highest need population. And we know what the highest need population, it's homeless families, in terms of the development, the impact on the child development, the impact on the vulnerability of the family. So making sure that the resources are getting to the right individuals. So making sure that those resources are getting to homeless families, and then identifying some of the barriers that are prohibiting families from accessing that. So I know you've done some cross trainings. So describe that a little bit, some of the cross trainings. What does that mean, cross training?
Cross training is, it was a training on one full day where homeless service providers came and spoke about the services that they provide, and then early intervention providers came to discuss the services that they provide. And so it was so that each provider can learn about the other provider and learn how to service the population better. So I know one of the challenges right now is with the strict guidelines that early intervention and early Head Start have to follow. It's meeting them in shelters, and there's a lot of difficulties there and challenges. So it was discussing those barriers and how to overcome them and how we can work together. And it's a very, very interesting experience because it's learning about a different provider that you may have had no knowledge about, and now you can access those providers to help service the population even better.
And I think those cross trainings are fascinating because I think many times it's dispelling the myths, and really looking at, and helping, let's say, the early Head Start providers, really understand if those services are supposed to be provided in the child's natural setting. Well, that natural setting is a homeless shelter.
Exactly.
And that's where those services need to be provided. And then at the same time, having homeless providers recognize if you want a specialist to come in and provide these services, you need to have space. You need to recognize that this is important for the child's development. And I think, clearly everybody wants to do good. It's a question of how do you make everybody kind of realize, like, oh, we all want the same thing. How can we make it happen? So how does someone access the services? I'm going to put up the contact information here. But how do folks access the services?
Sure. For FACT, what we now require is to have a referral made by a figure in your life. So it could be a doctor, it could be a priest, it could be a shelter staff worker, it could be somebody from the hospital. They call us and they make the referral. We'll usually fax out or mail the referral form so that it can be filled out and then sent back to us. And then after that, we one of us will call and do an intake screen to see if you are eligible for the program. If you are eligible, then right now we have a short waiting list, but once that waiting list is smaller, we usually call back and we'd start doing the intake itself to start services.
And I know, clearly the goal is to, meet the families where they are, to get them stable, and then to get them housing.
Right.
And it's not just a housing program. It's it's the match between the services and the housing. Mm-hmm. And, I mentioned earlier one of the Beacon projects is a family homes initiative where we're working with highly vulnerable families. Mm-hmm. And the development of the tool that the city is using to identify highly vulnerable families really emanated from what we learned from FACT in terms of how the age of the mother impacts the child development, the likelihood of the family staying together, the age of the child, when they were first pregnant, how many children they have. So clearly the goal is to find the housing and provide the services to really stabilize the family. Now, I know FACT has some measurable outcomes. Can you talk a little bit about some of those measurable outcomes?
Sure. A lot of the outcomes that, at least with participant success stories, we measure them based on their goal setting. Some of that, could be something as small as I will become sufficient on my own to find transportation to get to work every day. So it's taking the positive approach and the strength-based approach to support that participant and helping find those ways to meet their goals. And so that's probably the main way that we would measure our goals, and FACT's goals is just based on the participant's goal.
And I think, what's great is that, clearly that's what, helps the project move along. The participants drive what they're going to work on. I know on a project as a whole, we do some solid evaluation of it. And I know right now in this community where everybody's trying to make sure, is it effective?
Right.
And we have had a national evaluation on the initiative, and we did show that child development either was improved because they showed initially with delays based on a standardized assessment, or it maintained on target. And again, based on what we know, the impact of homelessness on children, we know it derails their development. So the fact that they remained on target is great. We also noted a reduction in mother's stress. And, parental stress really can lead to abuse and all kinds of other kinds of things. And a reduction in parental stress is really important. And that's another outcome that we've been able to assess based on the administering of some standardized tests. And I know keeping a family intact has been important. You mentioned suicide earlier as a crisis intervention approach. A lot of these mothers have attempted suicide prior to coming into the initiative, but after having been in the initiative, we haven't had any.
Haven't been any, no.
So I think it's that level of support, and some moms graduate. Oh, actually, I haven't been showing pictures. I just realized I had some pictures of some of our kids, but I know we have moms that graduate. So these are some of our kids, and so what are some of our graduates? What have they been doing? Can you comment a little on that?
Sure. A lot of our graduates have become employed. That's one of the main goals for most of our participants, is to find employment. A lot of them even have said, I don't want to have to rely on programs. I want to become financially stable on my own, but I just need the help to get there. So employment is number one. A lot of them are very focused on building a stronger relationship with their children. So it was getting them into daycare, finding activities that they could do together as a family. Also finding stable housing. Many of them want to be stably housed rather than be moving around all the time. So it's finding that apartment that they can stay in all the time and not have to move every 6 months or every year. Those are probably the main things that our graduates are doing now.
Which is great. And I know last week somebody called in and say, how do the participants give back? And you were telling me earlier that actually we hired one of our participants.
Yes.
And she's done fabulously. But I know you were telling a story earlier that one of our graduates, what do they do?
A graduate from last year actually just donated one of her old cribs to one of our current participants who just had a baby. So now they're giving back to each other, and it's awesome to see it, because a lot of our current participants even give donations of clothes on a monthly basis where we get bags full of clothes to give to other participants. So they're always giving back to one another.
I think that's so profound, again, because they asked that earlier, but I know sometimes we've had callers on like how can they help, and I think these are the kinds of things that make a difference, because these are young moms, or these are just moms who are homeless or formerly homeless, or or doubled up, and what we find is that there's a full array of things that they need, very basic things, from cribs and strollers,
Yes.
and diapers and formula. So those are the kinds of things that I know that we look for the community to support us in. What would you say are some of the unique things about working at Beacon or this project, and what you're doing now?
The most unique thing is, you don't know what's going to happen from a day-to-day basis, and those challenges, I think, are the things that keep us going. So it brings us back to the table where we have to discuss it as a team and try and figure these things out. It could be a system barrier, it could be a participant barrier, it could be several different things that we have to try and work and overcome. And I think that's the uniqueness of working as the team, at least, where we can always come back together and try and overcome these things as a team, and then try and advocate for our participants on a systemic level, on a personal level, on an individual level. And then the uniqueness also is just being able to know all of these participants, see their resilience, and work with them so closely, get to know their families and know the ins and outs of, who they are and what they need and how we can help them better.
I love the fact you brought up resiliency, because I think that's something we've spoken about in the past. And I started the show off and talking about how we know these families have challenged beginnings, and we're providing them new endings. And I think there's this core belief in our families' capacities to persevere despite everything that they have faced, and that's what keeps people going. And I think that's what you're describing, is that we believe these mothers want to be the best mothers they can be to their kids, and they want to see them succeed, and they want to create a better future for them that they had. And so I think that's why this model really has been effective in helping these moms realize that. And so it's a small, intense initiative, but at the same time, it's really having lasting impact on the children. So where do some of our little kids go? Do they go on a preschool or kindergarten, or where have you seen the kids go once they finish?
Sure. Well, some of them are currently working with Beacon's Early Head Start program. So they work on attachment and building a closer relationship, as well as developmental needs. Some of them are in the Little Intensive Outpatient program within Beacon. These are some of the children who have a little bit more need for behavioral issues, but they come out with a lot of success stories where they're better able to regulate their anger, they're better able to soothe themselves and get along with the other people in their classrooms. And then other children are in the mainstream school system, CPS. Some of them are also doing daycare or other preschool programs within the community.
What would you say is the length of time the families are with the program?
The average, I'd say, we have a few that have been there since
the inception.
And those are some of our more severe participants. But the other participants, average, I'd say probably about a year.
Yeah. No, it's I think when we looked at it, it was like you're 12 to 18 months, I think. And I think that does describe that people really dictate their own course of treatment, so they can be involved as short or as long as they need to. So we have about a couple minutes left. Do you have any final thoughts or any final comments on the work or anything else you'd like people to hear?
FACT is just a very unique program, and it works with mothers who have been taken away a lot of chances from when they were younger, and I think it's just such an important program because it gives those mothers the chance and the voice and the opportunity to be understood for probably one of the first times in their lives. And it's just so important to work with them when they have such a lack of resources, and to work with them on building their families and helping them become stronger.
Well, it's great work you're doing, and I thank you, because clearly you're making a big impact, not only on the mom and the child now, but also in terms of their future and where they're leading to. So thank you very much, Melanie, for being on the show. I actually would like to give a shout out, special thanks. This is our last show, so happy holidays, everyone. And I'm going to special thanks to Barbara, Tiffany, Steve, Amari, Sylvia, and Kazuko, the intern. Sorry if I messed your first name up. Thank you very much. And Melanie, thank you again for joining me.
Thank you very much.
And we will see you in the spring, I believe. Thank you.